Okay, so we'll get started. As I said, I'm Dr. Mark Poznansky. I'm here at the Massachusetts General Hospital. We've been holding these webinars every month or so on what we view as important topics for our community in healthcare to understand about the crisis in Ukraine that was caused by the unprovoked invasion of Ukraine by Russia, and focusing on what those healthcare needs are. And on this particular call, the work of the NGOs addressing these very significant challenges. We have I think, a phenomenal panel today aligned to speak each about their own personal and professional experiences helping in Ukraine, and obviously inspiring people to hear it at any time, in particular this time, given what they do to help Ukrainians deal with a very, very serious situation in their country. I normally start out and I'll get to the introductions in a moment, or I normally start out with just setting the scene. We are part of what's called the Heal Ukraine group. This is just some of our members, physicians and scientists within the Harvard Medical School sort of healthcare system, committed to help in Ukraine directly as best as we can through work with NGOs. And just the situation currently, these are sort of what I could get from the internet, just to remind people that this was a unprovoked invasion of a entirely independent, free, democratically elected government-run country, Ukraine, by Russia. That's a population in Ukraine of 44 million people. The scale of this most definitely harkens back to the beginnings of the Second World War type level of decision-making by Putin and the Russian military, that Ukraine as an independent nation didn't have a right to exist. That's a thing that happened in September 1st, 1939, when Russia and the Nazi forces in Germany basically decided the same about Poland. And Poland was essentially wiped off the map in about 30 to 60 days, 60,000 dead and 6 million dead 5 years later. So the scale of what we're looking at is absolutely enormous. And also changing, as the speakers will allude to, on a daily basis. Other statistics are relevant. The millions of individual refugees recorded across Europe since the 24th of February 2022, 7 million or more individual refugees, 2,225,000 children in need of humanitarian assistance. The scale of these figures are enormous. And then obviously these documented attacks now up until September 22 of attacks on healthcare facilities, hospitals, ambulance, healthcare supplies, infrastructure, probes into the attacks by Russia, deaths of healthcare workers, and then all of these other multiple violations of Geneva Conventions targeting civilian infrastructure, looting of property, mass killings, mass graves. And I think the point I want to make before we get to the speakers is there's a very powerful Ken Burns documentary out there at the moment called The US and the Holocaust, which details what did people know when and where. And just to remind people that this documentary is being made 70 or more years after the event. We are 6-7 months after the initial event, and we know a lot about what is going on in Ukraine in terms of the crimes against humanity and the targeting of healthcare. And what I'm most focused here is on making sure that that information, led by people who are actually on the ground helping, gets out to the greater community. I just highlight this particular report, which comes from the United Nations International Commission of Inquiry on Ukraine, involving NGOs reporting specific attacks on healthcare facilities. Here's a facility highlighted, Regional Mental Health Care Center in Vorgel. The facility was occupied by Russian forces for 35 days. suffered indiscriminate shelling. The troops retreated. The facility was planted with mines. Its equipment, drugs, medical devices were looted, and service cars damaged. The scale of it is so significant, and this is all being reported assiduously as war crimes are accumulated. What our focus is the nearly 580 humanitarian partners that are providing life-critical aid and protection services to 13.4 million people. This also comes out of that same report in terms of the balance of what people are doing. So I just want to now introduce our first speaker today. We've got Nelia Melnichuk, Lindsay Martin, Mariana Petrea, Imena Kova, and Mickey Noah Malone to speak to us today. Nelia Melnichuk is a wonderful colleague of mine here in the MGB system, assistant professor of surgery, and president and founder of GMKA, that we work with very closely to get them assistance to get both their educational work and their surgical relief supplies to Ukraine, with help from a number of different NGOs, including Lake Country Aid. So I'll hand it over to Nelia.
So I'm Nelia Melnichuk, colorectal surgeon at the Brigham and also founder of Global Medical Knowledge Alliance, an organization that has been providing educational resources to Ukrainian physicians and patients even before this full-scale invasion. We have talked about this organization, about our organization and what we do on prior webinars, but I'll just kind of give an update and discuss the next steps and what else is needed in Ukraine. And thank you all for joining. And thank you, Mark, for such a wonderful introduction and setting the scene. As we all hearing from the news, even though Ukraine has been making advances with freeing up new territory or occupied territory, just recently, just yesterday and today, new attacks are underway that are targeting Ukrainian civilians, infrastructure, hospitals, and it does not seem that we're coming closer to the resolution of this conflict, and we just have to help and provide Ukrainians as much as we can. And as you probably all know, I'm Ukrainian as well, so it's all just very, very close to my heart. So as I mentioned before, GMKA supports Ukraine through education, analytics, and medical supplies. And our focus is to provide Ukrainian physicians with Ukrainian materials that they can easily to understand and follow. Since the war started, we expanded some of our work. We initially were focusing on oncology, but quickly realized that education on trauma is very important. And with the help of physicians at Mass General and Brigham and Women's Hospital and other institutions, we have created a good amount of educational materials for physicians and patients in Ukraine on trauma, and you have those listed here. We have also been working on providing educational materials for Ukrainian mothers, and recently have been collaborating with Harvard Humanitarian Institute and International Medical Corporation to provide in-person trauma courses such as ATLS, Stop the Bleed, Mass Casualty, Pre-Hospital, CBRN courses, and nursing trauma courses that Lindsay will also talk a little bit later on in this presentation about. Another thing that we are focusing on is to provide observership opportunities for Ukrainian physicians, and that we do with collaboration with Harvard Scholars at Risk, Christian Medical Association in Ukraine, Ministry of Health of Ukraine, National Cancer Institute of Ukraine, and also with the help of Heal Ukraine group, without whom it will be very difficult to organize this. This is just a team that arrived to MGH, led by Sergei Melnichuk, who is learning and lung and heart transplantation. That program has been requested by Ministry of Health. In the past, some of the transplants were done in Belarus for Ukrainian patients, and obviously at the time of war and Belarus is supporting Russia, that cannot be done. So there's a huge need, immediate need for Ukrainian healthcare system to start developing their own capacity in that. So that's kind of what's happening here with with this program. They just and observing good amount of procedures. Another thing, what we have done, we created Heal Ukraine app, and I would actually ask for people who are listening in to download this app and start helping Ukrainian physicians with providing them advice on how to treat specific patients that they had less experience with before, or the patients who are suffering from trauma or have more complex issue. This app connects physicians in Ukraine with each other, but also with their counterparts abroad. And it's just a one good way and quick way to help those Ukrainian physicians. What we have also got involved in since the full-scale invasion, we have been providing medical and surgical supplies. We work directly with hospitals in Ukraine and surgeons in Ukraine and respond to their acute needs. And we have been able to provide supplies with the help of multiple other organizations like Lake Country Aid and Heal Ukraine Group for the amount of $150,000, and we're continuing our work here. We're very proud that we do this work very quickly from the request until the fulfillment of request. It usually takes about 2-3 weeks, and we get that equipment to those Ukrainian physicians very quick. This is just a map of where we have been helping, and as you can see, it's all over Ukraine, especially in the east. That's where the active front line is. But even from yesterday's event, Kyiv was bombed, Lviv was bombed, Rivne, Ivano-Frankivsk, which is the city that I am, and we had little discussion before, but this is just a map to show you that majority of help in Ukraine is provided by local NGOs, even though the majority of donations have been forwarded to larger humanitarian organizations that unfortunately provided a little bit less help than that has been needed. So, and we're trying to stay nimble and respond to needs very quickly. And just a little bit of perspective to this talk. I actually just came back from Ukraine 2 weeks ago, where I was with International Medical Corporation and Harvard Humanitarian Institute doing courses. I was teaching Stop the Bleed course and mass casualty course. And also just got to know a little bit of what's happening on the ground, what are the acute needs are, met with Minister of Health to confirm that the work that we have been doing is needed, and learn about new possibilities of collaboration and support. And from that trip, and obviously all of our prior work, it just came up. We don't really have that much time, but those are the opportunities to help from Ukraine, from the community here. We are all working in academic institutions, so we can definitely help Ukraine with capacity building, can help them organize courses or participate in those courses, continue helping with educational materials. The need is huge. Observership opportunities are important in specific just oncology, mental health, transplantation, and we constantly work with Ukrainian sites to make sure that what we are helping them with is relevant, and getting their input, and also asking them to initiate some of those requests. Provide research opportunities for Ukrainian scientists, and also advice to Ukrainian physicians. Continue with help with medical and surgical supplies. There's lots of wounded soldiers, lots of wounded civilians. Ukrainian health scheme is robust, but definitely needed help even before the full-scale invasion. And now the need is, just expanding. And then donate and continue to advocate for the weapons for Ukraine, for the support from international community. Russia has been waging informational wars as well, and there's lots of misinformation that's in social media space. So we just have to continue the support. And we are very grateful at GMKA for all the support from the community. Brigham and MGH and throughout United States. And we will just continue doing what we are doing and responding to Ukrainian needs. So I don't think I have that much time, and I think we'll have a panel afterwards to answer the questions.
Nelia, thank you so much for that. That's a great overview. And I think the point to just highlight before we quickly move to Lindsay is just this thing that I think is forgotten a little bit, which is that the whole medical and nursing educational system in a time of war is under enormous stress to continue training doctors and nurses, not just specifically for war, but to continue their training. And so we, with the help of Nelia and with Harvard University, the Office of the President under Jane Unruh, we're helping them support a Scholars at Risk program to continue these observerships and training opportunities for Ukrainian doctors to get during this time. I think that's often forgotten. Medical schools, nursing schools under enormous stress at these times to continue education when there's such a huge frontline need for care. I'll pass over to Lindsay Martin. I'm very honored to have you on. You're the Director of the Global Disaster Response and Humanitarian Action for MGH Global Health, a wonderful center here at Mass General. Lindsay, take it away.
Okay, thank you, Mark. And Mark, thank you for mentioning nursing, because I feel like we are always the sort of forgotten ones in the response, yet we provide about 80% of the healthcare workforce in any given emergency response and then on any given day. So definitely something that I'll address in my talk today. I was very bold and for the first time in my life decided not to create slides. I thought I would sort of speak extemporaneously about my experiences from February until now, and part of that was yesterday when I was creating my presentation. I was also sort of processing what was going on the past 2 days. On a very personal level in Ukraine, I have colleagues there. I have made friends there over the past year, and it is deeply personal for me at this point. So just to start out with, MGH Center for Global Health, Disaster Response, and Humanitarian Action has not been traditionally in the conflict space, but as we all know, there's been an overwhelming global response to what is the war in Ukraine. And so very early on in February, we, based on the sort of momentum of response that was brewing within the MGH community, I decided that I would go in late February to Poland and that I would make my own assessment of what the needs were on the ground, both in Poland and countries surrounding Ukraine and in Ukraine, to see, given the number of resources, how we could leverage those resources back home, how we could organize groups at home to be as impactful as possible. So on my way over, I brought about $200,000 worth of pediatric transport ventilators and circuits, which were immediately donated to various evacuation pathways through the Ukrainian Ministry of Health. And I met with United Nations, other NGOs, and what I found was that there was, this enormous momentum of response, and what I call sort of the big 10 NGOs were on the ground already. The borders were kind of covered with national emergency response teams from places like Poland, from places all over Europe, the UK. And there was a larger response than I've honestly ever seen to any other crisis in the past. And since then, I've been back 4 times. I'm leaving again tomorrow to go to Odessa. I've definitely appreciated sort of a waning of that response from the big 10 NGOs now down to what Nelia was referring to as sort of more nimble, smaller scale NGOs. And the reason is because in emergency responses, particularly in conflict, a lot of times the smaller scale NGOs can meet the needs where they are, and also form networks to sort of leverage our different resources So one example of that Nalia shared is the trauma training education program that we have engaged in with International Medical Corps, Humanitarian, Harvard Humanitarian Initiative, and MGH Center for Global Health. And we've been able to do about 3 months of 6-course trauma training for nurses and doctors in Ukraine. So the situation from February to now has changed dramatically. Obviously, there's about 17.7 million people in need of humanitarian assistance. 14 million of those are in need of healthcare assistance, and about 16 million of those have, at various points, had very little regular access to both water and are facing food insecurity, particularly as we move towards colder months. Civilian life is extremely difficult, particularly not as much in the urban centers, although that's obviously changed in the past couple of days, but about a fourth of people living in villages, or 26% of people in villages, have no access to healthcare facilities. Some of the major health issues that we're seeing are people are living in communal settings, so increased vaccine preventable illness, increased risk for exploitation, gender-based violence, mental health, trauma is an obvious result of what's happened, food insecurity, and then the worsening of both communicable and non-communicable chronic diseases. As Mark alluded to, there has been an overwhelming amount of attacks against the healthcare facilities in Ukraine. This past year, 2022, 70% of all attacks against healthcare facilities have happened in Ukraine. So that's about 434 of the 615 attacks reported globally have happened in Ukraine. So you can just imagine what that does to the infrastructure of the healthcare system. And then the disruptions are worse in non-governmental controlled areas, so areas where the effect to the healthcare infrastructure is not being reported. The threats to programs like tuberculosis, HIV, viral hepatitis, people have had impeded access to chronic medications. The UN Flash Appeal estimated that about 9% of HIV treatment sites are operational in places like Donetsk and Luhansk. So only about 9% of people are able to access chronic medications for HIV. So the question for this webinar is really, what are the long-term interventions or impacts that we can have as smaller scale NGOs? And as I alluded to before, I think forming networks of small NGOs like we have on this call today to meet specific needs and be very, very mission driven is important. So I've actually worked with Nalia, I've worked with her husband, Sergey. I work directly with Health Tech Without Borders, so Mariana's group, who we'll talk about. And in that work, we've all been able to be very goal driven and specific in projects that we've been able to both start and complete. We have to continue to keep supply chains open. So as I said, there's been a dwindling attention, with our 24-hour news cycle, as there always is, to what's happening in Ukraine. And it shouldn't be just because there's been serious missile attacks in the past 2 days that we're advocating for keeping supply chains open, particularly for access to medications and healthcare supplies. And then I think most importantly, given how fluid and shifting the operational context is in Ukraine, meaning that one day you may not find yourself on the front lines and the next day your healthcare facility is on the front lines, we have to continue our efforts to support and enable Ukrainian providers to care for patients who are victims of trauma, particularly war trauma. So really critical needs are the provision of medications and also assistance to people who have chronic diseases who are affected by the limitations of war. Part of how we've chosen to do that and how we've kind of scaled, we've clarified our mission is that we are focusing on nursing education. So we're working with another NGO global response management, the Ministry of Health and the WHO to develop a 15-month nursing trauma training curriculum that will hopefully be able to deploy in the eastern parts of Ukraine, particularly around Kharkiv, and we haven't identified an area in the south, so that we can use this opportunity to help bolster the education system for nurses, because as I said at the beginning of this talk, they're often the forgotten ones in any given response, but often also the worker bees. So I'm going to stop there. I believe I'm probably at time, but there will be time for more questions in the question and answer. Thank you, Mark.
Yeah, thank you, Lindsay, very, very much. And this point about the broader healthcare system and nursing training, I think that's amazing what you're planning to do. And again, from the Scholars at Risk and HUG program, we're very interested in broadening support, whatever we can do in that, in terms of bringing people over to train under the sort of giving back to Ukraine type of approach. I want to introduce our next speaker, Mariana, got this right, Petrea Iminakova.
Thank you so much.
Thank you very much for joining us. And you're the founding member of Health Tech Without Borders that we've had mentioned before, and obviously we're very lucky to work with Jerome and you on wherever it makes sense. So yes, Mariana, take it away.
Yeah, thank you so much for inviting us, and let me share my presentation. So a few words about Health Tech Without Borders and our work. So we're a global nonprofit organization, and we support communities affected by different humanitarian emergencies. We act as innovation hub because we focus on bringing digital health solutions to patients and clinicians. So
Mariana, do you want to put it into presentation mode?
Just a second.
And I'm not sure that they're scrolling, but.
Can you see my screen?
Yeah, we see your next slide, yeah.
That's fine?
Yeah.
Okay.
I think it's flipped to your third slide without getting through your second slide. Sorry.
Yeah, but it's just a short information. I can start from this one.
Okay.
So for Ukraine, we delivered already 65,000 consultations through the telehealth platforms. We implemented, during the first 2 weeks of the war, we implemented 3 different solutions in telehealth space. With the help, of course, of 800 volunteers from 20 different countries which participated in our call to action. Now we're active also in Mexico and other countries, and we run a big mental health Helping Healers Heal program. Just to show you a bit of our story, so we started from providing free of charge access to primary care, and we were mainly focused on the pediatric help. But then we decided to build the digital ecosystem, which means to bring different solutions in different domains of digital health. So starting from clinical care models to data management, medical devices, mobile and web applications. So we work in our NGO as a multidisciplinary group, and we actively involve medical professionals to define the critical requirements to our solutions we consider for deployment. We also established in Health Tech Without Borders Academy and creating the first tele-disaster online course for medical professionals and students, as well as for the technical communities. So our next 2 big deployments which are coming this month are the virtual hospital we created together with VC. This is American telehealth company, official supplier for NASA. And another big deployment is the chatbot for the first medical help, which is available already in English and Ukrainian languages. and we work together with Microsoft Disaster Response team on this solution. So talking about the challenge in delivering digital health, of course, this list can be very long, and many of the points Nelia and Lindsay discussed already, but I'd like to focus more on the digital health space. And of course, working in work conditions means absolutely unpredictable environments. So even to deliver remote help, medical help within the digital health tools, we are dependent on the infrastructure, meaning electricity, internet connectivity, and what the previous days show us that it's absolutely unstable, unfortunately. So other difficulties which we faced is migration of population within Ukraine into the neighbor countries. It's very difficult also to reach the patients, to reach the clinicians who left Ukraine. All our partners working in the digital health space in Ukraine faced with the cybersecurity issues with cyber attacks. And talking about healthcare system, yes, Lindsay said already many things, and unfortunately the data we have and the data from the Ministry of Health already outdated because of the yesterday events. But of course, the patient profile in Ukraine is very different from Europe and from United States. It's high comorbidity, very high level of stress, which influence on the telehealth, providing the telehealth, because the first minutes that this is what we train our clinicians, they should spend just to count patients for them to express and to define exactly what their problems are about. For delivering telehealth solutions in Ukraine, of course, we faced with the language barrier, which was very big, honestly. But our call to action for from the very beginning was for Ukrainian and Russian-speaking clinicians abroad. So all this, almost all 800 people who participated in telehealth consultations were speaking Russian or Ukrainian languages. And the last point which I would like to mention is, of course, we face with operational and organizational issues. And here, the lack of centralized approach in NGOs collaboration. I think this issue we can work on together to make it better and to work more efficient in this space. Thank you so much.
Thank you, Mariana. Yeah, thank you, Mariana, indeed, for your work. I mean, you've mentioned quite a few challenges there. How do you address them? I mean, for example, with regards to the cybersecurity and availability of the internet and power, energy. We were talking about that a little bit earlier on the call before this. How do NGOs cope with that? I mean, are there generators? Do they use specific systems for maintaining their internet connectivity during a time of war?
So the easier question is the first one about cybersecurity. It's very difficult. Yes, yeah. We take it very seriously, especially that we work with volunteers. We are very careful with the personal data of patients and volunteers. But here we can rely on our partners and experts in cybersecurity field. Yeah, so of course, in all projects, we have like a collaboration umbrella of different companies from tech side working, being specialized in different areas, and cybersecurity is a very complicated topic. Yeah, about the energy, for example, now we will supply the container for the educational purpose for the nursing medical school in Ukraine, in Vinnytsia. So we insisted it's from the very beginning to have sun, solar panels and to have generators. So it's unfortunately either you will put everything together or people will not be able to use it, because it was somehow predictable that yes, these facilities will be targeted.
Yeah.
Unfortunately. Yeah.
Well,
Thank you so much.
Yeah, Mariana, thank you very much for that. We'll pass on to Mickey Noam Alon from JDC Grid. Mickey, can you start out, because you know GMKA, MGH Global Health, and most Health Tech Without Borders are well known to us here at Mass General and within our networks. Can you tell us, just give us a little bit on JDC Grid, its background, before just telling us what you're doing there, because I know you're doing a lot in Ukraine and have done for some time.
Yeah, hello. So I'm Mickey from JDC Grid. JDC is the American Jewish Joint Distribution Committee. It's a very old Jewish NGO working in over 70 countries around the world. And my department Grid is doing humanitarian impartial support to people everywhere. We work in Ethiopia, in India, in Haiti, and everywhere there's a crisis. And we provide both healthcare, health support, women empowerment projects, and food security and agriculture programs. And we've been working in Ukraine since the beginning. Part of it is because another branch of JDC, of the joint, has been operating in Ukraine for the last 3 decades. So we were able to utilize this vast existing network of people that already worked in their communities, already knew the different municipalities, knew people around, had the logistical services, so we can bring kind of the maybe international scope and utilize that. At the beginning, we started by supporting the Israeli field hospital that was set up just across the border. We supported instead just funds and also telemedicine devices and remote technology that was then utilized in hospitals in Ukraine. So we kind of made this connection between hospitals in Israel and hospitals in Ukraine, and can have this kind of remote consultation and ongoing support, both in technical tools, portable ultrasound machines, different diagnostic tools, that they could enhance their capacity during the first stages. In addition, we worked across the border in Poland with opening a clinic, a mobile clinic that supported over 20,000 people, refugees across the border in different stages. That was running for 5 months. Today, the situation is a bit different in Poland. We did 2 things there. One is provide medical support for people that came to the shelters. And the second one is to provide kind of ongoing psychosocial support outreach. So social workers that will go into the tents, to people's bed, allocating women or people that are in distress, children that needed support, and could kind of connect them to different tools, connect them to, we made connections to people in other countries that could support them, not just medical support, not just psychosocial support, but help them kind of do this extra push, because once you kind of leave the country, a lot of the adrenaline falls out and many people were asking themselves, what's next? So that's the point where we could have a lot of intervention. So that went on for a while. In addition, we have a telemedicine program in Bulgaria. That's a Ukrainian doctor in Bulgaria that's providing the Ukrainian refugees that are spread across the country with direct support in their language. And they can, although they could have support from the Bulgarian system, very generous support, obviously the language, sometimes the cultural barrier would prevent them from doing so. So connecting a Ukrainian doctor that could see in real time their diagnostic and could support them was very useful. Our focus in several recent months are on rehabilitation. We see rehabilitation both as an acute need, a very strong acute need, and kind of a long-term program. It's an opportunity to kind of minimize the long-term social impacts of the war, right? War is just the beginning of the story. And we wanted to, we in a very early beginning, we identified that disability is always a gap. It's always kind of overlooked. People with disabilities, with mobility, with problems in the mobility. It's not the first priority of many, unfortunately. So early on, we started sending assistive technology devices to both Kiev and Odessa, and we made connections and started learning the situation in Ukraine. There's a big significant pre-existing challenges in rehabilitation. 80% of the individuals using assistive devices needed to purchase them by themselves. The country subsidization is limited to some extent. Since 2014, as far as we learned, only then, more organized and significant training and focus on how rehabilitation has been done in the countries started to get this attention. And now there's a huge gap because there's not too many professionals, not too much experience in the complexity of combat-related wounds. In Israel, for example, when someone gets injured and needs rehabilitation, it can last almost a year, subsidized by the government. In Ukraine, it's much, much shorter, and people literally, as far as we learned, live in the hospitals and they need to take care of themselves. That obviously been translated to the gap in community-based rehabilitation. How do people that come back to the community are coping with the new situation, their family members, of course, the trauma that relates to it. So this is a very strong gap that we identified in the early stage. But something that is very true to Ukraine, and I think to many cases as well, is that there is a very strong motivation of the government, a very strong civil society, and it is a fact that many of the organizations that operated right from the start were local organizations, local volunteers, local initiatives, and the international system kind of tried to catch up with it with the enormous funding that couldn't yet trickle down to all those organizations. But there's a very strong need in making the system better, in learning, in creating new policies, in adapting rehabilitation pathways from the different zones. Part of it is the Medivac program, which takes rehabilitation patients, so that every patient from conflict areas, and instead of sending them to hospitals in Ukraine that may lack the capacity or be overwhelmed, sending them to different NATO countries. This program has a lot of benefits, of course, in times of conflict, but one of the things that has been criticized is that people receive initial treatment and then they need this kind of ongoing long-term rehabilitation care. And the effort now is to focus on increasing the capacity of the hospitals in Ukraine to cope with this situation. What we've been doing is we've been part of the coordination mechanisms by UN OCHA and WHO. We've been constant connection with them to both identify, understand what is the situation on ground, who are the partners, where are the priorities. We've been using our own network, as I said, of the JDC to help us logistically distribute assistive technology to make connections with both government officials, local NGOs, hospitals. We started a project of training done by an Israeli hospital, and it's kind of matching between an Israeli hospital, Sheba, and the Ukrainian the Lviv First Unit hospitals on rehabilitation, both on kind of the systematic approach of how multiple disciplines can come together and collaborate on the same patients and see the patient from different sides, on the structure of the restructuring the department, and on specific tools and capabilities. So this will be a kind of an ongoing Israeli delegations to go to Lviv, and in the future, Ukrainian delegation coming to Israel to see the work of the hospital there. In parallel, we've been training 80 social workers teachers, nurses, people from the community in psychological first aid and community resilience. One really nice thing about it is to see how people kind of could have additional tools to help their own communities, help IDPs, internally displaced people in the communities that are coming to cope with the situation and collaborate between them and build their own professional network to support people on the ground. And now we're scaling this program into, we hope, a state model adapted, created with the ministries in Ukraine, Ministry of Social Service and the Ministry of Health, and local professionals, and that is to create a model adapted to the Ukrainian system for what we know. Definitely one of the main gaps and main concerns that's going to happen really soon is winterization. The Russians has been publicized as trying to focus on destroying energy facilities, and the amount of IDPs, the amount of people that are that don't have shelter and need winterization preparedness is overwhelming, and that is also part of what we're looking forward. And that's it about us in a nutshell.
Thank you very much. Much appreciated. And it's amazing breadth of what you're doing. Do you want to talk a little bit, and maybe I'll open this up to the panel, that this, you call it winterization. That's a term that we use for, like, you know, you kind of think of it from the point of view of your car in winter. I mean, winterization from a medical care, rehab, nursing, medical, you know, is really major. What are you doing, Mickey, to position for winterize, you know, the oncoming winter? Mariana, similarly, what are you thinking about? Just briefly, if we could just go round and just get some questions, because that's ahead here and a very significant thing. Mickey, do you want to start with that?
Yeah, so again, we're focusing on two main things. One is the work with the hospitals, and the other one is working with IDPs and with communities on resilience and psychological first aid. In addition, the organizations we're in touch with are trying to see in each community they work what kind of, there's no big technology to bring in. It's basically blankets and equipment and shelter and funding. A lot of, there are many cash-based support in Ukraine that's been very common, but essentially everyone is kind of concerned of what's going to be and how long this war is going to end. So we're preparing for that. A lot of equipment that's been sent out. But again, hospitals are going to be in challenge in terms of electricity, in terms of access.
Yeah. Mariana, any other insights on the winter? Maybe Lindsay as well, if there are things you're thinking about that will, you know, be season-specific type of aid that will be needed. Lindsay, do you want to? Oh, Mariana.
I mean, so sorry to interrupt you. I don't think there's like a magic bullet. I think that it's like sort of what Mickey said. It's right now unpredictable what the effect will be, but it's predictable that the effect of negative 20 degrees Celsius temperatures and what's already going on is not going to be positive. You know, it's the things that people will need is access to reliable food, water, and energy sources to heat their homes, or at least heat places where they can reliably and safely shelter. So it's figuring out how we can all partner to do that, given that we also have other focuses, like there's health technology, rehabilitation, and teaching and education are just three disparate things that we've already talked about on this phone call, but how can we all bring that together to address what is going to be the major crisis in a couple months?
Yeah. Mariana, any technological thoughts there?
Yeah, so why we are put a lot of hopes on solutions like the chatbot for the first medical aid, because we think that we hope that it will help also with educational purposes, and will take, it's like a self-education mainly. Yeah. So which means that both civilians and medical professionals will be able to do it by themselves. Yeah.
Yeah.
So, and by technologies like this, you can cover significantly more people, and it's absolutely free of charge solution. Yeah. Another thing is that, yes, of course, we should focus more on delivering the telehealth as well as we did before. Yeah. To bring more medical professionals, and probably to organize hybrid patient care, like sort of the community clinics where Ukrainian clinicians will be able to work together with, let's say, virtual hospital settings and clinicians from other countries, including Israel, United States, Canada, and so on. So really, we need to step in as a global community from this point of view. Yeah. And here, I think that, yes, we are learning a lot, and this is a very difficult process.
Yeah.
It will be impossible to predict the next weeks and months.
Yeah.
But yes, we should prolong to work to focus on our next steps, and as we always say, deliverables. Yeah, first. Yeah. So, and just to work. Yeah.
Can I just ask Nelia and Lindsay about the mood and state of kind of general health of doctors and nurses in Ukraine? Are they aware of the support? Are they, I mean, we talk about burnout here. Burnout in Ukraine is a whole different issue in a time of war. Lindsay, what are you seeing amongst the nursing profession in Ukraine? I mean, given your vista on this.
I think there's a real regional component to it, because there are nurses that have been more or less exposed to the violence on the front lines. But I think that overall I've seen both a fear, but also a real eagerness to kind of make this an opportunity for some sort of progressive movements, at least in the discipline of nursing. So I don't think that nurses are not backing away from this challenge, similarly to, think, like, early COVID for us. Very different, obviously. I would say, an eagerness to engage.
Yeah. Nelia? Yeah, sorry.
No, I mean, I just to finish, but nurses are also civilians, so they face the same challenges of food insecurity and heating their homes as everyone else. So I think as healthcare providers who are interacting with other healthcare providers, that's an area of focus that we could have to support our colleagues.
Yeah. Nelia, what you see of the medical profession there, you have a lot of colleagues over there.
Well, yeah. So, I mean, they're all working really hard in very challenging environment and very unpredictable environment. Even yesterday, they were able to complete their first cases of the day. I spoke with surgeons and couldn't do the second ones. So then you don't know, will you be able to provide that care that patients need, even like immediate care? And that puts in addition to everything else, and worrying about your own family, puts a lot of stress on you. Also, like physicians in the west part of Ukraine are overwhelmed because large number of patients did move west. So physicians on the front line as well, because large number of patients to take care of with casualties. So obviously there is element of burnout there, but they are very grateful of all the support we are providing. One thing that I wanted to say in terms of the winter and challenges with electricity and heat, and also just all those unpredictabilities, one thing that actually possibly will happen, the same thing what happened in the spring, like, so for example, patients with oncological diseases might actually need to wait for their operations, and one good might need to, that the rest of the world might need to step up again with with helping move those patients where the care can be given in a little bit faster or more predictable fashion. It just seems like in the summer, everything was at least stabilizing a little bit more, and things were becoming a little bit more predictable, and physicians learned how to care of the patients in the system that they had. But now things are changing again. So I think we just have to be creative, and the same thing for all of us, people who are trying to help, trying to stay stable and see what the needs are, try to respond to them quickly, and just listen to Ukrainians as well, what the need is. I feel the most important thing for all the NGOs and for everybody who's trying to help is to really learn what the needs are without trying to impose their own solutions. I think that's really the key here.
Well, Nelly, I'm going to give you the last word. Thank you very much, everybody. Thank you for all the work that you do. It's absolutely amazing, courageous, and amazingly needed. I just wanted to end with a slide of a person that we were very honored to have on a call a few months ago, talk about human rights challenges. Alexandra Matvichuk, who gave a remarkable talk about the challenges, human rights challenges in Ukraine as a result of the Russian invasion. Now a Nobel Peace Prize laureate, her organization won the Nobel Peace Prize in addition to civil liberties, human rights organizations in Russia and Belarus. And we've just, as a highlight of our seminars, we were able to have Alexandra talk about her work there. For those who remember it, it's absolutely staggeringly, again, courageous and important what she's doing to document human rights violations by the Russian army in Ukraine. So that gives us a ray of hope that this crisis continues to be recognized on the international scale. And obviously the work of the NGOs is central to making sure that Ukraine continues to rebuild and restore its healthcare system at a time of war. So thanks everybody indeed. And we hope to see you on the next webinar. Bye for now.